I think for me, it's about understanding, as I've said already, it's not a one size fits all for everybody. And I know how you've kind of reflected on the experiences of people who may have lived through Section 28, but once again, it's a very UK centric focus on how we're exploring and navigating people accessing healthcare. I think, you know, within the 21st century, we're living in the world that we are today. People are transient. People are traveling between different places, between different countries, and of course, you know, you've got refugee and asylum seekers accessing the country. We've got economic migrants going in and out of the country, people joining their families, and so one thing is not making an assumption about people knowing how the healthcare system works here in the UK, because I think it can be very overwhelming for somebody who may not be used to living in the UK to understand how the system works, what people have rights to, what people have the right to access for free, the difference between sexual health services and mainstream medical services where the medical records are completely separate records. You know, a lot of people would just assume that one healthcare system is connected across all, so all of the information will be shared across it. So I think it's taking a step back to ensure that we're all on the same level of understanding and all at that same baseline level before sharing out wider messages.
Unfortunately, UK, while we are known being very multicultural and luckily enough in sexual health, very much advanced compared to whole around the world. But we are also very much lacking, especially when it comes to inequalities, health and inequalities in the healthcare. Localized campaigns for different demographics. This is really lacking. So I always say that training wider healthcare providers, it is really important because sexual health clinics are there. Yes, great if you are accessing them and if you are not embarrassed to, you know, go there and access help. We had an mpox crisis in the past year, and we saw how much UK struggles when it comes to localized and focused campaigns. And it's still lacking that. We did a great job giving away the vaccinations and stuff, but we really didn't think if people are not in the gay scene or accessing the gay Twitter maybe to read about the mpox or the vaccinations, what we're going to do about that. What if they don't want to be seen waiting in the queue in a sexual health clinic? How are we going to reach out to those people? Or if they don't follow anything about in the social media because of their community? We didn't think about that, and it was a little bit too late, and still many people didn't get their vaccinations into that, you know, when it comes to mpox. So putting the information out there is great, but we have to make sure that it's widely accessible to give people an informed choices.
Well, what can I add? I think I agree with that idea of being more specific in where you can and where you should be in terms of local demographics. I know public health has been decimated in this country over the last 10 years. And I think this is one of the net effects of it, that there used to be much bigger teams that were thinking about these things. And if the wider population was more comfortable about talking about sex as a more ordinary, everyday thing, then I think that reduction in wider stigma around sexual health and sex would filter over into other populations, including some of those populations which maybe might not have, so it's not necessarily all about language, isn't it? Some of it's about, I guess, heterosexual culture and its variants. The bit that we didn't really mention in this, I guess, in terms of a barrier is fear and mistrust. So I'm just thinking about the COVID vaccinations, and I'm sure everyone's got stories of how seemingly ordinary factual information, family mixed it together with misinformation and came to their own conclusions about what was right and what was wrong. It's not always about knowledge or facts. Sometimes it's about trust and a kind of longer term kind of relationship around some of these health things. And again, our health service isn't really structured for that. So it's much kind of like crisis to crisis, you know, big thing to big thing. But where that longitudinal, long-term work needs to happen, it's very difficult to get the investment and be that people or money.